Yes.
Okay, this is a true incidence. It happened in Germany. So what happened after Second World War? German been devastated by the Red Army invasion, Allied force invasion. So overall, German people population stress struggle was much more higher. So what they have tried, they tried to invent a sedative drug, uh, you know, for the population. But at that time, it was not mandatory. Now, if you want to market any drug, you have to have certificate for teratogenicity. It means in animal or pregnant rat, you have to give that drug and you have to see the teratogenic effect. So what happened here? The scientist group was so much in a hurry, they didn't did any research, any experiment on teratogenicity. So what happened in the whole generation? You may can search in YouTube thalidomide tragedy. The drug, the sleeping pill, is called thalidomide. So that thalidomide tragedy, I think few hundreds of children they born without hand or without feet. So how sad it can be, isn't it? And is almost a generation affected that. Since these incidents, what happened? FDA make a mandatory rules. Every drug company, before you market your drug, you have to go through teratogenic check. Okay, this you can see this one. Even a simple aspirin, okay, simple aspirin, some kind of any shares, painkiller, mother, suddenly you are carrying a weight, you know, during pregnancy, there are so many changes occur. A simple example, during a term pregnancy, mother gain weight 8 kg. Among that 8 kg, maximum amount is actually water, fluid. So what happened? This extra weight, they can feel back pain, they can feel headache. So what happened? Is nothing harm and over-the-counter drug. They may can take some initiates and see the outcome. Okay. Third picture. I'm sorry if it is not appropriate for some of you. Extremely sorry for that. From childhood, from the student life, some of the mother may be addicted with the smoking and alcoholism, and yes, it also have a consequences on the baby. So now you can see here, uh, some country, some regulation, in the airport when you go, so many scanning you have to go through, but you never know because pregnancy can be detected after 2 weeks, but probably after studying embryology, you already know in embryogenic period, the value of 2 weeks is tremendous. So once you're crossing through airport and there are so many security check-in and radiations are there, and radiation is already a proven teratogens for mother. Uh, without knowing, unconsciously, you are exposing with some of the over-the-counter drug, and you may can cause teratogenic effect to the baby. You are habituated somebody for some recreational drug, cocaine, amphetamine, alcohol, even smoking. It also have a direct effect towards the baby. So here, so in this session today, we're going to cover all this. What is actually teratogen? We have to deal with a lot of examples, and every month, every year, the examples of teratogens drug keep on piling on in pharmacology faculty. So list is getting really, really big. After that, FDA, Federal Drug Administration in USA, they have set some criteria. During pregnancy, only category A and B you can use. C, D, and X you never can touch. So they really prepared some safety parameter what a mother, pregnant mother can take and what really can cause teratogenicity for them. Definitely there will be involving, although it is not very clear, but genetical predisposition, environmental factor, your diet, and duration of exposure. Those are the factors are the determinant for causing teratogenicity. And if you give a drug, we always, scientists, we always keen to know what kind of effect it may can produce. So after drug effect is a very, very area of interest among the scientists. So trust me, most of the time the teratogenicity occur here. Almost 50% of the pregnant mother, either they have been prescribed because doctor don't know you are pregnant, or what you are doing, you are ignoring all the cautions, and you are taking some over-the-counter drugs or social drugs like smoking, alcohol, some other recreational drug. This is contributing 50% of teratogenic effect. Now you tell me, most of the teratogenicity occur within the first 2 months of pregnancy. First 2 months. If I go more precise, organogenesis occur within first 3 weeks of pregnancy. So sometimes mother detect they are pregnant after 2 weeks. So that's why the problem occurred. That's why I think the social awareness, now while we are educating not only the MBBS student, doctor student, even other general students also, to enhance awareness among them. That if you are married, pregnancy will never announce, hey, I'm going to pregnant next month. It never happened like that. So many times it occur accidentally. But you have to be really, really careful when you are in a process of getting mother. Okay, so in general, drugs shouldn't be used. Somebody said only water or saline. It is until that much restricted. So what happened? Drugs should not be prescribed during pregnancy unless it is absolutely necessary. So there are some ordinary nausea is common in pregnancy. There are some ordinary headache are common in pregnancy. Lower abdominal pain are really, really common in pregnancy. Urinary burning sensations, those are also common. Remember, pregnant mother, slowly they reduce their immunity. So many trouble they can overcome, they have to counter during this period. So you have to be very careful while you are choosing the drug. Okay. Okay, about 2 to 3% of the birth defect result from the drug that are taken to treat a disorder or a symptom. So what only 2 to 3% are symptom specific treatments driven, because no specialist in the world, no licensed doctor in the world going to prescribe, because after this session, all of you will be knowing what to give, what not to give. When you should say no to the mother. Whatever, how many times she is crying, I need medicine, answer is no. So I believe after this session, you're going to know about that. So this is a Greek word. Let's go to the terminology. Teratogens, actually monster forming. So a normal baby, it should be so cute, but because of your mistake or because of your doctor's mistake, you are giving an appearance of a monster. And they are so much neglected in the society, and functionality, they also suffer a lot in the community. So definition, anything, any agent, chemical, radiation, your social recreational drug, disturb either temporarily or permanently development of embryo, either whole organ or some system or some part of the body, it is termed as the teratogen. Let's go for the details. Teratogen cause permanent alteration of structure or function of an organ. Okay, when most of the teratogen, this is also a criteria. They should exert their effect during embryonic life, not after delivering the baby. So during embryonic life, any particle that disturbing the structure, function, development of organ, it is teratogen. Now, it is very difficult to come up with the complete list of the teratogen. It's almost impossible because every day lots so many researches are going on this matter. So invariably, drugs is number one culprit to cause teratogen. Secondly, physical agents likely radiation, extreme heat, mostly radiation. Those are the culprit or causative factor to cause teratogenicity. Number three is very important, is the dose and duration. Okay, so dose and duration. So normally, a mother suffering severely with the tooth pain, very severe tooth pain, and they have to go for tooth extraction. maybe at that time they might need to take X-ray. So the technician should be very focused. They should take only, the length should be only onto the mandible area. They shouldn't use very high wavelength of X-ray while they're taking. And maybe if they know mother is pregnant, so that they should reduce the, it's like a snap, so they can take a faster snap of X-ray. So very crucial is, if you know your mother is going to expose with the radiation, so please try to reduce the dose and the duration of the exposure. That really has a very important effect on outcome of the teratogenicity. Now, you don't care. People are talking about teratogens. People are talking never ever expose, never fly. Don't take unnecessary medication. Do you think you'll get a this phase baby? But we all expect. You guys can hear me or Tidur?
Can hear you, doctor.
Okay. All of us, we expect a newborn baby should be look like this. But what happened? Mother didn't had enough knowledge, didn't really practice the knowledge, didn't follow the instruction from the doctors. Probably she's not going to get this phase baby. So if it is occur within the first week, majority time it is a dead baby. They eventually die if it is within the first 1 week of pregnancy. From first day of conception, fertilization until 60, some books saying 71 days, there will be gross malformation like cleft palate, there is no kidney, underdeveloped aorta, so there will be massive malformation. For some reasons, your growing end of the bone, it will be deposited with some particle that have a calcium affinity. Example, tetracycline drug is haram. It's really, really prohibited to prescribe tetracycline to a pregnant mother. But what happened? We are in a kind of cosmetic era we are living. Pregnancy come up with a lot of pimple because we are going through so many hormonal changes. During pregnancy, in early part of the pregnancy, your body shoot up estrogen and progesterone. So when you have an alteration in the hormones, so what do you see? You can see some pigmentation, you can see some acne, and you become gila for that, crazy for that. Hey doctor, I cannot tolerate this pimple. Please give me some medication. So that might be fine with the patient, but if you are, I don't know what kind of doctor, and somehow you prescribe tetracycline, and in especially underdeveloped country or country where people are not very cautious, what they do, I'm talking about my country, we doctor, we wrote example, some safe drug, okay, ampicillin. But pharmacy people, they want to sell their expensive drug. You say a same drug, don't worry. You don't take ampicillin, but you take tetracycline. So what happened? Those broker, to increase the sell and increase the profit margin, they are giving a pregnant mother tetracycline. So what will happen? Those tetracycline love calcium so much. So during intrauterine life, they are going to deposit in their enamel, into their bones, so they'll be very short stature. So that's how growth retardation and some functional disorder. Like uh, in England, if somebody here from British passport, you already know, it is a mandatory in UK. Once you're planning for pregnancy, okay, somebody get married, then counselor will ask them, what is your family planning? Okay, we don't want any baby for 2 years. So you guys can go for short-term contraception or long-term contraception. But if you're wishing to take baby, please, you have to start folic acid soon. Why? Because I said in typical setup, the pregnancy notification diagnosis is occur after organogenesis done. Okay, so that's why functional disorder means if you don't supplement folic acid, there will be neural tube defect, problem in the development of spinal cord of a baby. So all these are actually either doctor's mistake or patient mistake. But you may can come with all these consequences rather than a very healthy, cute baby. Okay, so now, who actually is teratogen? What we really should remember about teratogen. So teratogenic substances or drug, they have always a selective organ. Okay, if I'm talking about phenytoin, phenytoin is already a proven teratogenic drug. Tetracycline is already a proven teratogenic drug. Anti-cancer drug, always a proven, it is already 100% proven teratogenic drug. Girls are there, right? Any lady can respond with me?
Yes, yes, doctor. Yes, doctor.
90% female in this world, you guys like makeup, and you are, although you are very white in, complexion is fair, you want some more fair. If you don't trust me, you Google Datosri Vida. Check how fair she is, and after that, how much of makeup she is eating. There is a reason why I'm telling it. Girls are using or not whitening cosmetics?
Not everyone, doctor.
Hey, I never saw in my life any girl who doesn't wear makeup. It's
You
impossible.
see one now.
Okay, so what I try to say, what is those dazzling, shining material in the makeup? Do you know that?
Mercury.
Yes, zinc and mercury. Very good. Who is that?
Me, Dinakim.
Okay, after Mary, you print a poster. Mercury can cause skin cancer and teratogenicity. So please avoid of makeup. Trust me, with that money, you can buy a new car. Can or not? So what I try to say, you collect mercury from any source, doesn't matter. It is teratogen. You buy phenytoin, carbamazepine, is an teratogen. So here, characteristics is malformation indicating selectivity of certain organs. So each of the teratogen has a specificity for certain organ. I think I have a list. You can see later on which drug cause malformation in which organ. And not all drug providing their effect in the same time. Some causing in early embryonic phase, first trimester. Some they're doing in second and third trimester. Some maybe can cause even, and like morphine, it causes teratogenicity just before delivery. There is a story I'll tell on that. And also, those also very, very important factor. So regarding teratogen, these are the key factors we really, really have to be in consideration. So here, so principles of teratogens, as I said, permanent alteration of the structure or function after exposing to the embryonic fetal life. So you give a teratogenic drug to a mother and you ask the mother, please put your finger on your throat and vomit. It doesn't work like that. If they continue for a few days, damage already been done. Okay. Now, gestational timing is very, very important. My professors used to say only water first trimester of pregnancy. If vomiting, you cannot eat anything. They said, whatever I take, I vomit. Then say, just take water or dry cakes and cookies. If you cannot tolerate spices, don't eat it. Only water. Because the most vulnerable period for teratogenicity actually is first trimester, within first 2 months of pregnancy. Most of the dangers occur at that time. So gestational timing, you have to remember rest of your life. So determine what structure of the fetus are developing at that time and exposed to what kind of teratogen. So safe in first 60 days, don't give any medication, not even paracetamol. Dose also a factor, amount of teratogen also affect the severity and the appearance of the defect. Duration, because they don't know during initial period of pregnancy, there is a headache. So somebody taking aspirin, they're like, okay, if I take aspirin, it is really giving me comfort. So I continue until 2-3 months of pregnancy finish. So best thing is always, man, you should accompany your lady to antenatal checkup, perinatal checkup, and really comply and show 100% compliance with the advices given by the doctors. Now, at the beginning of the session, we said the number one particle during pregnancy was the chemical structure or the drug. It was the most important determinant factor to cause teratogenicity, right? Okay, because why? Not all other ordinary particle radiation is different, because some drugs, they are smart enough to actually cross placental barrier. So once they can cross blood placental barrier, they can cause teratogenic effect, isn't it? So again, so here the phase of pregnancy is very, very important. So I think I reconfirm, I'm keep on telling you, first 2 months, no drug. Okay. Physiochemical property, mostly lipid soluble drug, you have to really, really consider. Even recently also we learned one lesson. Have you heard the two drugs, dexamethasone and betamethasone?
Yes, they are corticosteroids.
Very good. One of my patient, from my country, called me, and he got some fungal infection in his groin, and I asked him to actually buy betamethasone, but he bring dexamethasone, and he sent me the photo. I said, I asked you to buy betamethasone and you buy dexamethasone. Why? He said, pharmacy said it's both same. Both are steroid and it's going to cure my problem. Then I said, go to that pharmacy and give a slap to that guy. He said, why? I said, you see, dexamethasone has a higher absorption capability, but betamethasone has less absorption capability. Now you got problem on your skin. So I want your ointment should not be absorbed. It should be localized. But the same, both are ointment. But if you compare, dexamethasone has a higher percentage of absorption. So it will go to the blood. It's not going to work to the local area. Paham tak?
Doctor.
Okay. During pregnancy, frequently mother complain about urinary tract infection, because during pregnancy immunity fall, they become more vulnerable to get any infection. So UTI is very, very common. So at that time, you should choose a drug who is more water soluble compared to lipid soluble. Why? Because it will go through your urinary channel and it will kill the bacteria in the urinary tract. But if you choose antibiotic with high lipid solubility, alhamdulillah, it will cross the placenta and it will cause teratogenicity. So these are the small matter that really give you one day satisfaction, that I really recall those small factors, those small pharmacokinetics parameters, and I make a difference. So what I did, I asked my cousin to go and change the drug. Instead of dexamethasone, you get betamethasone. So what will happen? Tropically, it will stay longer, so that he will save his money. So same goes during pregnancy. Don't give lipid soluble drug. Here, physiochemical properties of the drug. So more lipid soluble drug, more chance of traveling through the placenta and it will deposit it into the fetus. Okay. Some drugs are just lipid soluble. Some drugs are highly lipid soluble. You just imagine a situation, a 3rd month pregnant mother met a road traffic accident and she need correction of the fracture. I'm sorry, you cannot give her general anesthesia. You cannot, because that is too lipid soluble. Then you have to choose either one. In many movies you saw, doctors are asking, you want mother or you want baby? These are the deciding factors. So now, alhamdulillah, we got ketamine, we got some other, local anesthesia, we can perform those kind of procedure. So here, degree of lipid solubility also a factor. Duration of exposure. If you are so skillful, if you can done one operation or orthopedic procedure in 2-3 minutes, probably you can go, because it will take time, to cross. Distribution characteristics. As I told you, during pregnancy, mother gain a lot of weight. The 8 kg weight, 60 to 70% are actually water. So you thought at term pregnancy, nothing wrong. I give a water soluble drug. Wrong. It will be deposited within the mother body. Now her water volume is much more longer, isn't it? So I think I have explained everything. So pharmacokinetics, lipid solubility, and degree of ionization. So more lipid soluble drug, it has a more possibility to go to the fetal circulation. Especially this is a thiopental or any sedative drug. It will cause, it will make the baby much more drowsy and less reactive. So we have to avoid. Mother has to find some other way to make us sleep. We cannot prescribe sleeping pill to the mother. No. Gastric emptying and okay. These are the final fine matter, simple matter. Always people they overlook. During pregnancy, estrogen, progesterone, both is increasing. Progesterone has a very peculiar characteristics. It can reduce your gastric slowing. Okay, it will reduce your GIT motility. So what will happen? If your stomach emptying time is prolonged, if your GIT motility is less, gastric content will be there for longer or shorter?
Delayed gastric emptying, so longer.
So longer. So drug absorption will be more or less?
More.
More.
Better give a small dose drug to the mother. Carry sense or not? So a normal person, example 500 milligram aspirin, just give mother 250, because she will take long. That's why a pregnant mother, eat small amount. Their gastric time is so prolonged. Progesterone relaxing her body. Okay. Absorption of the drug, inhalation route also. There will be increased absorption, because why? Cardiac, there is increased cardiac output and increased tidal volume. I think most of you know, during pregnancy, mothers normally they train to become anemic, so their cardiac output is much higher. So even if you give any inhalational drug also, if you give normal dose, there will be more absorption. So more volume of drug, it has a more tendency, more possibility to go to fetus. One second, my professor is looking for me. I'm having this lecture class with you after how many months?
After a whole semester, doctor. Mm-hmm.
I think since MSK.
I didn't migrate to any part of the world. I was here. So what happened? So this whole gap, yeah, I did have class with other faculties, but not with the MBBS students now. So normally I love to give freshly prepared classes. Every time I try to change the class. So yesterday night I give you the last year slides, so that day before yesterday, so that you just keep on continuing study. But since last 2 days I was working on this class. How about the PBL?
Okay, doctor.
I was there. I was there. Why no
Sorry,
answer?
doctor, can you repeat your question?
I said there was a PBL recently, right?
Yes.
And I was going through all this hormone, pregnancy, reproductive system for my classes, right?
Yeah.
So if I could have the PBL session, is it harmful for the students or benefit for the students normally?
Beneficial?
Yeah, I have done my part. I wrote a letter to the management. We hired M01. Is there anybody from M01?
Yes, Dr.
Who? Apa nama?
Dr. Nabil.
No, I'm asking for your name. Who talking to me now?
It's Akmal, doctor.
Akmal.
Akmal. So Akmal group got a migrated lecturer for PBL. He's been imported lecturer. And I'm talking all this when even recording going on, because that is my character, you guys know that. So he is a imported lecturer. Well, I was not used. Now Akmal groups Iman and justification. What was really proper for them? Okay, so sorry, I was distracted with the phone call. Now, what happened? Mother may be suffering from some other chronic disease. Because pregnancy happened suddenly. Mother might have gone through arthritis. Mother might have suffering with bronchial asthma. We don't know. And forget about general patient. How many percent doctor also know? I'm not sure about that. So what happened? Continuously somebody on steroid therapy, if they become pregnant, if it is a baby girl supposed to born, you will see some muscular feature on them. So their body will be tough building, that really doesn't look like a real feminine look, because steroid going for muscular proliferation. So during pregnancy visit, you should ask mother, are you under any medication? Are you taking steroid for some other reasons? Or are you been to oral contraceptive pill before? We have to ask all these questions. See, in feature D, steroid and placental hormone displace the drug from their plasma protein binding. So free drug concentration, normally it will go to so it is free drug, right? So steroid is a highly lipid soluble drug, and it can transfer, cross the placental barrier, and it will go deposit it into, if it is a female embryo, it will have some man-like feature. If it is boy, okay la, maybe. But always steroid has so many adverse effects. Why I bring this matter, actually, sometimes it hurts. It's nothing ego matter. Sometimes it really give you pain, because I'm here. I try to give my 100% dedication. My politics, somebody may not like, that is different matter. I don't know why they like or why they don't like, but that shouldn't be disturb student learning. That shouldn't be disturb student learning. Otherwise, if they make decision, I can pack my bag and I can find other job. But I'm here, and eventually, directly, indirectly, medial way, lateral way, student going to suffer, which is not acceptable. Okay, why I'm telling, because I think our salary is coming from all of you. Okay, so now another very important factor is molecular weight. See this example first. Not, don't read here. All of you can follow me.
Yes, doctor.
Yes, doctor.
I'm telling so many spicy stories so that you guys not going to be sleepy. Spicy or not?
Spicy, doctor.
Yeah. So with all this spice, please don't sleep. See this example. Heparin also a anticoagulant. Warfarin also a anticoagulant. Clear? Who's told you a 32-year-old mother got hyperlipidemia problem? She is taking prophylactic myocardial infarction drug and she got pregnant. Nowadays, with this present corporate era where people are so conscious about career building, they want to secure a high profile job. Eventually, they get hypertension, diabetes, or hyperlipidemia. So, what happened? So, now this is the technical matter. Your pregnant mother need a anticoagulant, but we have to really think smartly. Heparin molecular weight is 2000 Dalton, whereas warfarin is so small. But we are saying anything around 300 to 500 Dalton weight, it will cross placenta, it will go to the fetus, and it will cause teratogenicity. So among these two drugs, heparin and warfarin, which one you want to choose for a pregnant lady, if it is must to take for her anticoagulant?
Heparin.
Heparin. Why heparin? Because
Molecular weight.
yes, more than 1000 is almost impossible to cross placenta. So it will be remaining within the vascular compartment of mothers. It cannot cross the placental pores. Clear?
Okay, doctor.
Okay. So here, Allah has given us a magic protein, you know. This is not less than a magic. This is called P-glycoprotein transporter. It's like an immigration police into the placenta. It really literally sweep out everything coming from maternal blood. So mother can be a smoker, mother may can take chili padi, mother may can suka makan rendang. I think now most of the international students, you are familiar with this food.
Doctor.
Hey, it's the biggest mistake if you don't try rendang, because I slept myself. I used to see rendang in the shop. I thought, okay, Lord, this is so much chili and it will cause my acidity. Once I tried rendang, I think it is one of the best meal I have ever had in my life. Chicken curry. Nothing can be more tasty than rendang. So what happened? Your mother, you are taking, pregnant mother, they become very, they develop hunger because you are developing a big flesh inside your body, right? So they love to eat, and most of the time, like, you know, Pakistani lady, Bangladeshi lady, they love beef biryani, mutton biryani. So every country you have your own. If Arab lady, probably they will take a lot of kapsa or all those food. But do you think that fetus can tolerate your chili padi, green chili? Can or not?
No, doctor.
Cannot. So who is kicking out from the placenta? This P glycoprotein transporter. So what happened? They pump back whatever is coming is toxic to maternal circulation towards fetal circulation. But what happened? I'm going to discuss it later on. Some genetical mutation, bad luck. What happened? This protein developed malfunction. So once this P glycoprotein transporter compromised or cannot work, anything can pass into the fetus. And in those cases, most of the time, you cannot keep the baby. It's going to die. Okay. So please always remember blood flow through the placental side is higher. Now, why I'm telling you this information, and somebody has to tell me what do you mean by Gibbs-Donen membrane equilibrium? What do you mean that? How to correlate this statement with the the membrane diffusion concept? Gibbs-Donen membrane equilibrium formula. Who can remember that? Have you ever heard of the Gibbs-Donen membrane equilibrium? Yes or no?
Can you repeat your question, doctor? I didn't quite catch that.
Give and donor membrane equilibrium physiology. What is the principle and how to correlate with this statement? Sachit, donor membrane equilibrium. YouTube or
Is it resting membrane equilibrium, is it?
no.
I don't think we've done it, doctor.
Donor membrane equilibrium. DONNAN. Donor membrane equilibrium or Gibbs. This is the scientist. You guys can see my camera, right? Can or not?
Yes, doctor, can. But the green screen, we can't see your screen because of the effect.
So what happened? This gives donor membrane equilibrium. They kind of socialist mechanism. It means if I have more, I'll donate you more. That is the country system. China, Canada. If you are a CEO, if the more you income, the more income tax you have to give. That is called socialism, right? Correct or not?
Yeah.
Yeah.
So this gives donor membrane effect. If some part of the membrane, because placenta is acting as a membrane, right? Natural membrane, right?
Yes, doctor.
So maternal side definitely going to contain lots of electrolytes, substances, drug, right? Correct or not? So you see, even the name is equilibrium. So it tried to equilibrate. So do you think fetal circulation is ready to take all those?
Not ready.
Not really. So please remember it. So in a pregnant lady, you need not to give a normal dose. You can give a smaller dose. I thought you guys are very good in physiology. Okay, ignore. So what happened during term, any kind of anesthetic drug, any other particle, anybody saw normal delivery at your home? Especially female, your auntie delivery, your any cousin's delivery. Have you ever saw it?
No, doctor.
I've seen once.
Oh Allah. It's like a 5 kg rice bowl, It's so big. Am I correct?
Yes, doctor.
You cannot imagine it not less than 3 football. I know you guys are not trusting me. The ladies, the girls you saw, you ask her. Am I correct? Not so thick, thin, but volume is like 3 football. Am I correct?
It was big. I was shocked.
It is exactly not less than 3 football size diameter. Now we teach in basic pharmacology to you, the more surface area, drug absorption is more or less.
More surface area, more.
More blood supply, more. We also teach you last time the host factor, the more vascularity, more absorption, more surface area, more absorption. So please be careful with the drug because placenta is getting bigger and bigger, and it is now it is 5 times, 10 times bigger than your stomach. I was also the first day my husband, when I was delivering, placenta, I pull 15 minutes it took for me to deliver the placenta. And when the placenta come out, I said, what I have done, is it I pull out the whole uterus? Then my professor said, no, you never saw, right? Now, so, Prof, this is my first day. This is placenta. So, like, how big? 3 football, it is attaching with the mother uterus. And they are communicating each other. You can see this picture here. This is the, actually the junction. This is cord, notochord. So fetus only connected with this, placenta got two parts. This is placental surface. This is the notochord. Only all this material, all this transportation happening within the uterus and placental body. But fetus is connected only with the placenta. So when baby deliver, I just saw only a small placenta. Just my professor said, pull slowly. Don't ever rush it, abruptly. Slowly it will be coming out. But it is coming out, coming out, coming out. It's like a 3 football size. And first day of husband, I said, I probably pull out the uterus of the lady. Then professor said, no, 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 no. It's not uterus. This is the placenta size. Then I got shocked. Some country, they preserve the whole placenta. Singapore, do you know the why? They preserve the whole placenta. Though this 5 kg, 7 kg, whole organ they preserve. Do you know that why? Do you know why?
Not sure, doctor.
Have you heard stem cells?
Yes.
Do you know what is totipotent stem cells? It's coming from, let me show you. Can you see my screen?
Yes.
Can, doctor.
So placenta, actually our life started with one cell, one zygote, right? So that one zygote, that one parent stem cell, from one cell we got the whole body. Now scientists, they know within placenta, they can separate out which stem cell can develop heart, which stem cell can develop your retina, which stem cell can develop your liver. So they are actually separating it. They are making the stem cell bank. This is another new era of medicine is coming. Pretty soon, people will not buy medicine. People will buy organs. Paham? This is already in the therapy, stem cell for myocytes. If somebody having myocardial infarction, they already locate out which kind of stem cells can originate to the myocytes. So that if you have a fibrosis in your heart, you can replace them. It will be function as a normal. So where we was simple, you have to be careful because for some people congenitally you can compromise with the very important, the sweeping glycoprotein transporter. If it is malfunction, you are ready to get the danger because your blood flow is higher, your surface area is higher, and normal anatomical structures are compromised, so that person have a more chance to develop teratogenicity. So I think this is the summary. So far what we have learned. So before exam, you only should read this summary. So drug should be, substance, drug, danger to cause teratogenicity if it is less than 500 Dalton, if it is highly lipid soluble, if it is an unionized drug, pH of the blood favor the, it means if it is a blood, our blood is slightly alkaline. So if you give alkaline drug, it will be unionized. So chance of teratogenicity is more, less plasma protein binding and some selective distribution, special distribution. Those drugs can cause more teratogenicity. Maternal property, drug concentration in the maternal blood in higher concentration, so more diffusion. It means give a small dose drug to the mother. So higher concentration with Gibbs-Denon membrane equilibrium, body will try to go for equilibration of the charges. So your drugs are nothing but ions charges. So they will exchange with the fetus. Uterine blood flow is quite high during pregnancy, so that also contributing, sending more drug to the fetus. Concentration gradient, again, it is relating to the factor blood supply towards the maternal is much more higher. Now let's go to the placental property. Lipid membrane of the placenta, lipid membrane of the placenta enhance transfer of lipophilic substances. So if you see the structure of chorionic villi, they are much more containing lipid particles. Surface area, as I said, it is equivalent of 3 footballs. The day, inshallah, you're going to do your houseman, you will remember me. And I got shocked. I thought I bring out the whole uterus of the mother. Okay. Now, FDA, they come up with some guideline. As per the previous reputation of the different drug, and if you ask me what you should remember for your practical life, for your practicing life, you should remember this chart. Why? We always try to be in zone A and B. Why? Why I'm saying, why FDA telling group category A are well controlled, thorough study been done among the pregnant lady and there is no fetal risk. So absolutely safe drug for pregnancy, category A. Category B, no evidence in risk in human, well tolerated. In pregnant lady, no evidences. Okay, but there may be a possibility because they find some study in animals. So if you got example, omeprazole. Have you heard the drug omeprazole?
Yes, doctor.
Omeprazole always come to category B. Why? Omeprazole in animal study, it show stomach adenocarcinoma. But for last 15 years, there are so many kind of clinical trials going on in human. There is no teratogenic effect on human. Tapi they already got gastric adenocarcinoma in animal. So that's why they're saying you have to be careful. For a short while, you can use it because pregnant mother definitely going to complain to you after dinner acidity because normal gastric time is 4 hours. For pregnant lady, it will be 6 to 7 hours. So when they try to go sleep, digestion start at that time. So when digestion start at the bedtime, mother feeling a lot of belching, dyspepsia, and acidity. So please go for other drug or for a short while, you can give omeprazole because it is in category B, which was safe to the human but got teratogenic effect in animal. Category C, this cannot be ruled out. Adequate, well-controlled human study at they are lacking because example, anti-cancer drug. How to get a pregnant mother who has cancer and pregnant? So you cannot get a lot of cases, isn't it? So that's why it's better not to use. So what I say, C, D, and X. X is already proven. As a medical doctor, you should memorize X and D. You should memorize. Okay. Please double check the reference from the autispregnancy.org. It's a government institution. They updating all the database regarding the teratogenicity. In some cases, they said like example, group C, metronidazole. This is I'm telling from my experience in hospital. Metronidazole is a drug. Animal study have shown a risk to fetus and lacking to, human data is lacking. Metronidazole is a very good drug for cholera, diarrhea, and dysentery. And India, Pakistan, Bangladesh, where the water source is so contaminated, very frequently you can have a cholera. So during cholera or dysentery, you are going to lose a lot of water. So now pregnant mother cannot have severe dehydration. If pregnant mother suffering severe dehydration, mother may can lose the baby. So risk. See what I wrote here. If the benefit outweigh the potential risk. So I have to give a pregnant mother metronidazole, which belongs to group C, so that I can treat the causative organism of dysentery, and I can reduce the severe diarrhea of a mother. I can save. Why? Because we didn't know anything black and white about human. They have got it in case of animal. So potential benefit, if I improve the diarrhea, mother will save. Maybe baby may can have some problem. So always we can really calculate benefit and risk ratio. Not all drug. I remember precisely we used to had a medical board meeting. Professors are discussing whether we should go for injectable because that lady was almost about to die, collapsing with severe dehydration and diarrhea. Then professor said, we don't have other choice. We have to save mother. There are some other drug even more toxic, confirmed teratogen. We cannot give that. For same problem, we can give other better antibiotic, but they belongs to D and X. But metronidazole was in C. Then everybody, I was also in that meeting, they said, okay, let's go for metronidazole because here benefit is outweighed the risk. And if risk, only teratogenicity for the baby, mother going to save. So if mother save, then we can try pregnancy later on. So that's how they are taking it out. So this table for me is very, very important. So most of the time with ABC, we are okay. D and X, if you give, you have to wash your hand with your license. Gone. I think most of you know organogenesis, which organ develop in which part, but roughly you remember major organogenesities occur within the 60 days of pregnancy. This is even a further precise breakdown. So CNS starting, brain and spinal cord development start week 3 until full term. Some people even do not develop their brain after become adult also. That is a different story. But for a neonate, you guys like spice or not? You guys like chicken original or spicy chicken?
Spicy chicken, doctor.
So tahan with Mila. So CNS development, there are some cases before die also they don't develop, so ignore it. But for a embryo, from week 3 until full term, CNS development occurs. So be careful. It can disturb the brain and spinal cord. Like lack of thyroid or excess thyroid has a problem with the CNS. So ear, teeth, palate, upper limb, genitalia, lower limb, and heart. See, third week already started heart beating. Why? How we know it? We had one case, school-going children accidentally, abused by the family member and become pregnant. Came to my professor. She was extremely religious. Within 3 weeks, she came and mother was crying to go for abortion. She took the sonography machine. She put on that, girl's tummy, and there was heartbeat was there. So somebody missed pregnant, period. After 21 days, embryo already developed the heart. Life is there. So my professor said, I'm so sorry, already life is there, I cannot do the abortion. So 21 days is nothing, trust me. With the hormonal changes, with the stress, with your exam, with your similarity index, with your result withdrawal, 21 days delay in period is nothing. But if your luck is bad, already embryo develop heart, eyes within another 1 week. So it getting a feature of a human. So please, this is very, very important to remember the steps involved in organogenesis. I think I will give you the slide later. You can see this video. So blastocyte formation, 16 days. organogenesis within 2 weeks. After that, the whole fetus. I think this will be much more better. So pre-embryonic period. When we call it pre-embryonic period, until day 31. This phase actually teratogens perform as a all or none law. If it is teratogen, within first 31 days, baby will die. In the home remedy, traditionally, there are so many occasions, there are so many unavoidable circumstances where you don't have any choice, but you have to terminate the pregnancy. Within 31 days, if you find those teratogens, actually it will kill the embryo and there will be miscarriage. So teratogens producing all or none effect. If it is teratogen, it will not survive at all. So traditionally, with some village people, they know what are the substances they have to give if there is a mishap, rape, or unauthorized pregnancies there. They know how to cause the miscarriage. They can do that. Period of embryogenesis until 71 days. So actually, first 3 months of pregnancy or 2.5 months of pregnancy is most crucial, because you can see most of the organ development occur within these 61 days. As I said, brain growth is a never-ending story. Okay, after 71 days, you only just can see the development of brain, and you have to be careful with the hormone, because muscle proliferation, female baby coming with the biceps, triceps, and six-pack, it doesn't look nice, correct or not? Correct or not?
Yes.
Yeah, because you see, during the last time of pregnancy, if you give hormone, you will see some changes in the baby. So this is the list, actually belongs to category D and X. It is already proven. So steroids, masculinization of the female offspring. So if you plan, you want to make your daughter as an athlete or sprint, you can go ahead. Otherwise, if you want to if you want your daughter should look like a daughter, please don't give mother steroid while she is pregnant. Lithium is causing some cardiovascular abnormality. It can cause diabetes insipidus, macam-macam. So this list, I think you have to remember. From exam, let me beat Jahat with you. For your MCQ question, there are 2 questions coming from this teratogenic drug. And as you know, I didn't get class for 6 months, definitely. Do you think I'm happy or unhappy? What do you think? Akmal?
Unhappy.
Very unhappy.
Doctor.
So should I take revenge or not? Human ma? Should I take revenge or not? Yes or no? Tell.
Yes.
Yes. So I took that. So to answer one question, you have to read whole this slide and also this slide. Then you will get only 1 mark. Okay? Fair or unfair?
Fair.
Fair enough. So this is very, very common topic, when you will be in, especially in pediatric world, very common. Mothers are coming with infection, hypertension, vomiting, common. I never saw a healthy, without any complaint mother is impossible. Okay, it's not impossible to get a mother without any problem. So commonly hypertension, diabetes, vomiting. At that time, professor will check who is the stupid pharmacologist teach you pharmacology. Tell me, you got a 15 weeks of pregnant mother and she got diabetes, hypertension. What will be your drug of choice? You see here, ACEI inhibitor, it will cause complete renal degeneration, lead to secondary oligohydramnios in baby. If you say ACEI inhibitor or angiotensin receptor blocker, trust me, he will kick you out of the hospital. Seriously. Your pediatrician will asking you, going to ask you, a gynecologist going to ask you, you got a mother with constant recurrent headache. What will be your drug of choice? Prof, aspirin. Okay. Get ready with your bag. They're definitely gonna kick you, because aspirin, it can close the ductus arteriosus. So what will happen? Aorta will be never in normal diameter. It will be congested. Aneurysm kind of aorta will be there because of one stupid decision by the mother or by the doctor. Same goes. Once upon a time, this drug was so famous with the lady, water-soluble antibiotic, but it can cause fetal nephrotoxicity. So, teratogenicity, already proven drug, their effect, you have to remember. Let's go to the thyroid, thyroid analogs. Village, poor country, village girls where, they don't take seafood enough, or their soil lack of minerals. Example, Afghanistan. It's a like kind of desert. Their soils don't have much minerals. So what happened? Chance of goiter is much more higher in those areas. So what happened? From the childhood, that girl is under thyroid hormone replacement therapy. So either methimazole, carbimazole, propylthiouracil, uracil, they're continuing for last 10, 15 years. So suddenly, young life, they get married. Girls will never ever agree before marry whether they have psychological problem, or they have underdeveloped brain, or they have thyroid gland problem. They will never address it. So what will happen? They will marry you, but silently they will take methimazole. So what will happen? The baby will born, there will be speed breaker within the esophagus and stomach. Very common. This is, esophageal atresia because of methimazole problem. So it's much more higher in case of first trimester of the pregnancy. So if you get married, please request your wife, don't hide anything to me. Share everything to me. You going to get married with a girl, she already set up for iodine 131. This is for lifelong, you're treating thyrotoxicosis. But if she's pregnant at that time, because first time pregnancy, nobody can detect properly, destruction of the fetal thyroid gland. Okay, so to me, I have to refer, I think, 2 to 3 books. All are this topic, I couldn't find anything in pharmacology book. Most of the things I have to refer to gynecology book, and I have to prepare from 2, 3 books. Okay, alcohol. It's so difficult, like never mother actually comply with the advices from the doctors, So if mother taking alcohol, what will happen? They have a very peculiar alcoholic face. Firstly, growth retardation, brain abnormality, thinner lip. So features are actually there. So fetal alcohol syndrome. This is just for nice to know. Or maybe if you have any friend or somebody, they are pregnant and they are drinking alcohol, please print out these 2 pages of my slide and present to them. This is the gift from Dr. Zahid. Keep it. Smoking, actually a spontaneous abortion. I got few friends after marriage, they repeatedly told me 2, 3 times they have the miscarriage. Many times you also going to listen in your professional life. Just ask them, how many cigarettes you smoke per day? You'll get the result. There is a reason. Who can tell me smoking can cause vasoconstriction or vasodilatation?
Constriction.
If who is shouting? Huh? Smoking cause vasoconstriction or vasodilatation? Vasoconstriction, right?
Yes, it's a constriction.
How many of you coming to nowadays in domain area? There is a satay shop, there is a Dicello, very fantastic food shop here. How many of you visiting here? Or any Arabian food shop? How many of you recently visited?
Yes, Dora.
Shisha smoker is male or female?
Well, I can see maybe male, Doctor.
No, la, don't scare la. I'm with you. Nobody can scold you. Female. I saw 90% shisha is nowadays taken by female. Girls, do you agree?
Yes, agree, Doctor.
No.
Agree.
Agree.
Agree. Because I can send you next 1 week data near my home. All the shops nowadays, or maybe equal lah. You know, but we men is okay. We don't carry baby. Female, I don't know that why they love to shisha and smoke. Vasoconstriction actually will cause hypoxia. So few of my friends already having few times miscarriage. Ask them how many. They said no, we don't smoke now. You smoke if you smoke now also okay. Your all the supporting artery, for uterine artery already constricted, narrow. So if they deliver also, it will be very poor health baby. Fetal growth retardation, abruptio placenta, placenta previa. It means placenta will be very relaxed and it will be coming. It will be it will be twisted. So if placenta is twisted, you have to go for early termination of the pregnancy. What started? It started with the tobacco. Mechanism I'll be telling you later on. It is due to vasoconstriction. There are some very high rich group of lady or celebrities, they are taking amphetamine, cocaine, also problem with the simply vascular supply to the oh god. So those actually disrupt blood supply to the fetus. So result is commonly there will be miscarriage or spontaneous abortion. So all these are the highest list after following smoking to a pregnant lady. Now mechanism. Why people having teratogenicity? So firstly, you need a raw material for DNA synthesis, right? So folic acid, dihydrofolate, tetrahydrofolate, then it is converting to methyl thymidylate, right? If I'm not mistaken.
Yeah, methyl.
Methyl thymidylate actually convert to purine, pyrimidine, and DNA, right?
Yes.
Yeah, I read from your all biochemistry slides. Okay, so folic acid deficiency actually cause neural tube defect. So please, after marry, the ustad and all those people, they should really advise. We, especially in the Muslim country, we should develop that culture. Okay, you come for nikah, you come for kawin, please be ready. If you're planning for pregnancy, ask your wife to take folic acid. Because within 2 weeks, 3 weeks, your spinal cord going to formation occur. If you lacking folic acid, there will be neural tube defect, cleft lip and cleft palate. So firstly, nutritional deficiency is one of the big mechanisms for developing teratogenicity. And this is the commonest one, number one. Number two, epoxide or arena oxide. These are the oxidative intermetabolites of many drugs like hydantoin and carbamazepine. So this metabolic product has a carcinogenic and teratogenic effect unless they are detoxified by the fetal epoxide hydroxylase. But not all fetus can produce sufficient this enzyme, or the dose. Mother was epileptic patient for a long time, and trust me, this also they hide from the new husband. They had the epilepsy problem. So what they do, behind husband eyes, they are taking either phenytoin or carbamazepine. So regular dose, because they don't have this medical knowledge. So they go with the regular dose. However, when they get pregnant, the drug absorption rate become much more higher. So plasma availability of the drug, it also going to be enhanced. So what happened? This carbamazepine or hydrotoin, they're going to supply EPO oxides or arena oxides. They are toxic particle or teratogenic particle to the fetus. So that will cause malformation. So husband will be telling, my income is halal, I pray 5 times, my wife pakai niqab and hijab and everything, why I curse by God? No, this is your lack of knowledge. Or we doctors community couldn't give you enough awareness. So please don't go for this drug. This anti-epileptic drug going to produce these toxic particles, metabolic products, and that can cause teratogenicity. Environmental and gene. Remember, I said Allah has blessed us with a magic protein that was P glycoprotein transporter, right? Remember?
Yes.
So if any mother lacking that transporter, what will happen? Anything can come in, and that will cause teratogenic effect. Maternal disease and drug. Just now I said epilepsy and any other anticonvulsant, ACEI inhibitor, if they're taking. For diabetes, for pregnancy, only insulin is safe. Any other oral hypoglycemic drug can cause teratogenicity. So during pregnancy, or if anybody develop gestational diabetes, only Sahaja insulin have to give. If you go for any other drug, please get ready for the teratogenic effect. So neural crest disruption. So what happened? Vitamin A, either excess or low. Either too low or too excess is going to cause a problem, neural crest or spinal cord problem. So retinoic acid or vitamin A. So please ask them to take really RDA amount, the required amount, either excess or low concentration. It will disturb the neural crest malformation. So again, it referred to the nutrients, maternal nutrients. Sex hormones, contraceptive pill, steroids, anything they cannot take. If they take, for any of the reasons, nowadays, females are taking pills to, increase their subcutaneous fat or want to enlarge some part of the organ. During pregnancy, stop all this nonsense. Why? It can cause genital carcinoma. Oxidative stress, epilepsy, arrhythmia, cancer, free radical. So excessive stress. This is advice to all the father or future father. Don't make your wife stress. If they are stressed up, what will happen? They're gonna produce a lot of superoxide. And I think somewhere I said superoxides are like a blade, moving blades. They can cut any tissue. So if they are producing much more hydrogen peroxide or superoxide, it is going to be toxic to the baby. Vascular disruption. Please refer back to smoking, cocaine, and also other recreational drug. It will not cause teratogenicity. In early phase, it will cause for spontaneous abortion, and very common, very common. Enzyme mediated. So as I said, angiotensin converting enzyme inhibitor, it has a selective distribution toward the nephron. So what will happen? It will prevent the formation of nephron. So total renal dysgenesis. So I think after searching many resources, there is no actual direct mechanism, unknown. It is from a gynecological book they are saying. However, After extensive literature search and book search, I come up with this kind of information about mechanism of teratogenicity. How can we do the prevention? How to prevent teratogenic attack? What happened? Planned pregnancy. So once you get married, please make sure when you guys want to take baby. If you plan, okay, next September we want to take baby. So July, August, you should start supplementing folic acid to your wife, and also diet and nutrition. If smoke, give to slap and ask her to stop smoking. If asking for vaping, take them to very strict Muslim country where they cannot find any vaping. Okay. Counsel about the harm of alcohol. If not, counseling is not enough, buy a rotan, but stop it. Folic acid supplementation you have to give. Please don't travel to airport, because airport is one of the area you cannot stop exposure to the X-ray. There is so many kind of screening and checking going on. So that's how you can really prevent the incidences or chances of getting teratogenic baby. Now, frequently doctors will ask you, what are the safe drugs then in pregnancy? We cannot cover all. A houseman cannot answer all that, but 3 fundamental situations they should be able to handle. Common infections, hypertension, and also diabetes, because these 3 are very common. Gestational diabetes, nausea, vomiting also there. I can tell you eclizine or histamine blocker is the best drug for pregnancy-induced vomiting because of beta-HCG. So let's go through what are the safe drug in pregnancy. So antimicrobial, mostly penicillin, erythromycin, clindamycin, and cephalosporins are considered pregnancy. Little bit of adverse effect, only sahaja to mother, mostly allergic or maybe little bit of diarrhea, but fetal still not detected. So safe drug, mostly penicillin. If you ask which penicillin is ampicillin, this is I'm telling from my houseman experience. UTI is very, very common. So 3rd generation cephalosporin or ampicillin are the drug of choice in case of pregnancy. Now, which drug you should not use, or you have to really calculate risk-benefit ratio? Those are aminoglycoside. Quinolones actually nowadays banned. Nobody using it for pregnancy. Growth retardation, ciprofloxacin. Sulfonamide, there will be internal hemorrhage and neonatal jaundice. Remember, I was telling about metronidazole. How many times I said? It was in the category C, remember?
7 times, I think.
Yes. So same time, you also going to see same problem during your houseman. If you get a pregnant mother with dysentery, and that is by amoebic dysentery, you try to do literature search. How many pregnant there is, because pregnancy reduces your immunity. Please go through a literature search where you can see the percentage of amoebic dysentery in pregnancy. A lot. So at that time, although gynecologists, they know it can cause neuropathy to the baby, but we have to save the mother. In certain situations, this drug is very phenomenal in controlling some of the diseases. So you got for infection safe or group A and B, and this should be in group C and C. D we cannot use. So this group actually in D. So hepatotoxicity, chloramphenicol cause aplastic anemia, gray baby syndrome, tetracycline. I already said you have to wash your hand for your license. So these are the drugs for infection you can consider, and please you have to memorize it. Okay, you have to memorize it. Medicine will not going to help much with so-called IRAD, GRAD, whatever. What you do, I don't care. But information you have to memorize. You have to remember. Authentic information. Among antifungal drug, almost everybody got problem. So you cannot use easily. Ask mother to bear with the fungal infection Once delivery done, you can suggest except meningitis. Then you have to choose either mother or baby. If mother develop fungal or candida or cryptococcal meningitis, I'm sorry, she cannot continue with the pregnancy. So all antifungal drugs having teratogenic effect. So mother coming, hey, I got little bit of whitening on my skin. Go take rest at home, deliver the baby, then I'll take care. Sometimes you have to be rude. Analgesics, you cannot give analgesics. There are a lot of problems. Did I mention you, as I said, aspirin on all NACS scores, the premature closure of ductus arteriosus.
Yes.
So please refer back to your book. What is the role of ductus arteriosus? And if you close it prematurely, what can happen? So analgesics is not at all advisable for pregnant mother. And later term of pregnancy, morphine very highly, it is responsible for respiratory depression or slow response baby. Apgar score will be very, very low. And if baby born with the hypoxia, chance of mental retardation is very, very high. Fentanyl is a drug nowadays people are using for anesthesia, sudden respiratory depression, and you can lose the baby. Lidocaine, all are local anesthesia, also got problems. So what I said, as much as less drug is possible, you have to give to a mother. So hypertension is another, being a houseman is your bread and butter. Don't bother about pregnant mother if blood pressure is around 130/40, because that is hyper circulation volume, isn't it? She is running 2 circulatory phases, so 130/40 just ignore. But if it is becoming more than 150 to 110, then they need hospitalization and very close care. So you have 3 options actually. I didn't teach you CVS, so I don't know whether you know it or not. Alpha methyl dopa is the #1 choice drug. Anywhere in the hospital, any hospital in the world, if you go, mother, gestational hypertension, first choice is the alpha methyl dopa. I don't want to tell details all everything because it should be covered in CVS. Second drug of choice is the labetalol. What is labetalol? It's a non-selective beta blocker, isn't it? So alpha and beta blocker. Third is nifedipine calcium channel blocker. There is an emergency situation in pregnancy, is called eclampsia, where mother having, because of mostly malnourishment, pregnancy associated with hypertension and convulsion. It can be so fatal, you can lose both mother and fetus. So you have to really, really take very seriously. My experience is with alpha methyl dopa, costly. If can afford is the best drug. Otherwise, sublingual nifedipine, not the oral one. Okay. If you go, you check to the internet information. I used to give, with the needle, you pick the capsule, and literally with eclampsia mother, I had to wait 7 hours whole night with her. Give 2 drops of nifedipine and check blood pressure every hourly. If still after 2 days, if it is more than always 150, we have to terminate the pregnancy. So 7 hours I couldn't move from the patient. So sublingual nifedipine I have given to her because she couldn't afford alpha methyl dopa. Please read these 2 drugs for their role in pregnancy. None of you can skip from houseman without using these 2 drugs, alpha methyl dopa and nifedipine. Why you cannot go for other drugs? Because those are all already proven teratogens. SA inhibitor, as I said, urinary tract abnormality or renal dysgenesis. Same goes with the receptor blocker, renal dysfunction, aldosterone antagonist, spironolactone. They can cause feminization of the male fetus, opposite of steroid. Diuretics you cannot give because it will reduce the placenta perfusion. So baby will be born with the hypoxia. So there will be mental retardation with the baby. So as I said, this is also another, actually pregnancy related 3 complications we are discussing: common infections, hypertension, isn't it? Now also diabetes mellitus. Insulin always will be the first choice. If husband telling don't have money, ask them to go buy, sell your motorbike, sell your ring, sell whatever you have, but we want Sahaja insulin. We cannot give any oral hypoglycemic drug because it will cause severe fetal or neonatal hypoglycemia. And severe hypoglycemia, it will cause shutdown of their neuron. Not recommended at all. So throughout this session, we have tried to learn what is teratogen, any particle permanently either disturbing an organ or some part of the body or function are teratogen. So teratogen, most of the time, they are showing specificity with some specific organs. We have to be very, very careful about the timing of the pregnancy. First 70 days are the most vulnerable to cause teratogenicity. However, if teratogen exposed after 2 months of pregnancy, it may can disturb the neural tube and brain development. You have to know some of the, the FDA characterization of the drug. So who are the drug group A, B, C, and D, and X? X, you have to remember with their effects. Okay, so I think that's all from me. I would like to open maybe 2-3 minutes for Q&A, and unconditional apology if I hurt anybody with my spices. Any question? I have one more class, right?
Yeah, antimicrobials for urinary tract infection.
Yes, I will give my best to prepare that class, seriously. Because I also have to prove, right? I can teach better than imported lecturers. And the internal resources. I should have my first priority, correct or not? You just imagine you guys, any of you at my position. How I can feel. Any question regarding the session?
Doctor, for the group X of drugs that cause heterogenesis, it was the table you gave us, right? The one having lithium, phenytoin, valproate.
Actually, there are much more, but I choose some of the commonly problem occur with pregnancy. But in reality, list is much more bigger. I cannot give all. So what I I summarized. I make some priority of the listing, and questions will be coming from there only. In reality, if you refer to any gynecological book, yes, list is very big.
All right, thank you, doctor.
Akmal?
Yes, doctor.
Any question?
I think no, doctor.
Seriously, I was missing PBL with your group.
Yeah, we don't know that you will be our PBL coordinator initially.
No, who is asking for coordinator? I just want simple class as a lecturer, ordinary, so that I'll be more than happy to the skill little bit I have or knowledge little bit I have, or I will read 7-8 hours for that class and I'll try to spread that knowledge to all of you. I clearly don't know why from last semester I don't have any class, and I also don't know how I should get it. Maybe one way, if you guys really think worthy of that, just write a letter to Dean. That's all. And definitely I'll be seeing another few days. Do you think without teaching much, not contributing with the medicine, I'll be here for long? Do you think I don't have that much self-respect? As far I know, I never hurt any of you. I never disrespect any of you. And this class, I also got suddenly. Maybe they are busy for some other work. So just zakat tumila. So it's okay. I think I'm curious. Eventually, I was missing to having any class with you guys. So if you feel is worthy of getting class with me, I think just write a letter to Dean. Or you guys write me a letter, doctor. These are the area we couldn't really go along with you, so that we don't like class with you. So that better I replace with another guy. Your education will be furthermore better. Well,
Oh, doctor, we like you, doctor. We really appreciate you, doctor.
No, I have a different view, because today my fate here, because I was protecting few students. To be precise, few of my mentees. I felt it was not justice with them, so I give everything to protect them. And I'm protecting them. And probably I was also a little bit of, we should give some respect to the students. So that really led me not to have any class for 6 months. Until that, we are we are inviting lecturer to have PBL. I know them very, very well because I used to be part-time faculty there. And when I used to go there, they even didn't sit in front of me. You guys are wise enough. You guys see their qualification, what is their basic degree. And it's lucky in Malaysia they're working in Faculty of Medicine. Not many countries they will get position in Faculty of Medicine. No, I was just curious for the reason. I thought I have given my everything if I have a class. So far with lecture, I just keep quiet. Okay, maybe they're angry. One day they'll be just okay. In a family, if your brother is angry with you, just keep quiet for a while. Maybe one day your brother will realize, okay, enough. We can forgive him at this moment. But we don't have much lecturer, and we are so prone to CUCMS. We like so much CUCMS. We got a few hundred, few thousand ringgit extra offer, and we just leave. But some of us are so stupid. We really mean we like, and we protect our company, we protect our student, and eventually we are not getting class. Even after they go also, we have to bring outside people. If it is recorded, not recorded, I don't care.
Sorry, doctor. We honestly don't know what's happening either. I think everyone is just very confused.
I think we were so wondering why suddenly you're not teaching us anymore.
No, I can give you the reason, because you give 3 minutes only or 2 minutes only for signing the attendance, and we don't have that much technical knowledge. You uploading a attendance paper in Selangor, there is no guarantee somebody in Pahang or somebody in Terengganu going to upload that link in the same time, or somebody might be in the Middle East, or somebody might be in the Maldives, same time it's going to be upload is not guaranteed. So what happened, for 2 attendance you are blocking the student, not they cannot sit to the exam, and you are giving only 3 minutes window for signing the attendance. I never, for my class, I never give any attendance. I never try to look who is there, because it's up to you. I know what I'm doing. If you want, you take. If you don't want, you don't take. Why I have to chase you so much at this age? You are 2 minutes late. You are 1 minute late. I also know how many times people calls are interrupting, how many times their video is dropping out, but the student never complain. We also take online classes. Our classes never ever, even for 2 second dropout, never. So I stand behind that, and I think all of you saw what happened in the WhatsApp group. Since then, after exactly that day, I don't get class. And I also don't know, I'm talking here, what will be after that.